So back to more kind of clinical issues. Safety, I keep talking about the side effect profile because it is quite favorable. So common things, drowsiness, dry mouth, fatigue, those would be the most common. There's no overdose known to man. And a lot of the time these side effects can be avoided with just proper dosing, which is essentially low and slow. You can have physiologic side effects, and it's related to dosing. So you could see orthostatic hypotension or tachycardia, which wouldn't be good in someone with unstable angina. But all of that is mitigated if you go slow. So slow meaning 2.5 milligrams of THC or CBD for that first couple days. Where you see the tachycardia, the hypotension is if you're looking at one of those droppers, took a full dropper to start, you could see some of those side effects. So with good advice, that can be mitigated. Contraindications, no-fly zones, pregnancy and lactation. That's just how it is. Most of those studies are with smoked cannabis, so there really isn't evidence for if someone was taking CBD or THC in an oil. But as it stands right now, it's a clear contraindication. Psychosis, more so with THC. However, CBD, it's still a little gray area, but most practicing cannabis doctors won't prescribe to someone with a history of schizophrenia or obviously a pregnant patient or someone who is breastfeeding. I kind of touched on caution in those unstable cardiac conditions. So patient does have unstable angina because it can cause an increased heart rate or lower blood pressure. It's important to be mindful of that, but it doesn't enhance the QT interval like some other medications. Children, teens, interesting kind of gap there. Health Canada is going to legalize it October 17th. Legal age is going to be 18. The College of Physicians and Surgeons doesn't recommend giving it to anybody under 25. So there's some varying degree there. But their stance is basically, unless there's some compelling evidence for an under 25-year-old person, they say don't prescribe it. But sometimes there is compelling evidence to use some formulation. Generally in those situations, I start with CBD. And then obviously no one encourages anybody to smoke cannabis anymore. There's reasons to use the inhalation method via vaporization. Nausea, vomiting needs to work quickly, and sometimes breakthrough pain is a good indication for vaporization. But again, I often use the oils or the capsules. Okay, interactions. Again, pharmacists, this is going to be a big question, right? Generally, drug interactions are rare. There really aren't any real studies showing, a specific drug and a specific reaction. We'll talk about one, but most of it are associated with the other CNS depressants. So a benzo, or someone has alcohol with cannabis. That's when you see an interaction. Clinically significant reactions are rare. It's oxidized by the CYP system. So 349 or 3A4, 2C9. So you can see increases with inhibitors and decreases in the levels with enzyme inducers. But again, that's mainly theoretical at this point. Clinically, we don't see that. The one exception is clobazam. So if someone's on high CBD with clobazam, you're going to need to decrease that dose. Dependence risk. It's still a drug, so people can have dependence. That's where it's important to be mindful. Again, it's not a panacea. There are issues that can be with it. However, it's the lowest dependence risk when you compare it to nicotine, cocaine, alcohol, opiates. That was a meta-analysis, so I think we can agree opiates and cannabis aren't even close to as far as addiction risk, but that's just the way that meta-analysis worked out. You can sometimes see withdrawal symptoms in long-term users, but they're not equivalent to an opiate withdrawal or even alcohol withdrawal, which is very dangerous. Cannabis withdrawal is usually they don't sleep well, they're irritable, similar to caffeine withdrawal, some say. Cannabis use disorder. So again, it's not all rosy and fuzzy. Sometimes cannabis can affect people's lives in a negative way. That's when it's essentially messing up their daily routine. It's really getting in the way of them being productive. So 12-month period, 2 or more of these symptoms is required for that diagnosis, and that's excessive time spent to get cannabis, persistent desire, ruining relationships, tolerance, continued use despite being told, hey, you're gonna lose a job, or hey, you're gonna lose your license. They just can't stop. That's when it's a problem.